Step back in time to explore the strange and fascinating world of old medical practices. In this video, we'll uncover bizarre images of treatments that once seemed revolutionary, but now make us question the past. From peculiar devices to unusual remedies, these historical snapshots reveal how far medicine has come. Stay tuned for a journey into the unexpected. This late 19th century image shows Dr. Louis Albert Sayer observing a patient self-suspend to assess the curvature of her spine before receiving a plaster of Paris bandage for scoliosis treatment. Sayer's innovative approach was a pioneering technique in orthopedic care, marking an important step in the history of spinal treatment. This image offers a glimpse into the early days of medical radiology. A patient undergoes an X-ray examination in Dr. Maxime Menard's department, highlighting the pioneering work being done in the field of medical imaging. It's a reminder of the risks and sacrifices made by early radiologists, as Dr. Menard himself would later lose a finger due to radiation exposure. This photograph serves as a testament to the progress made in medical technology and the dedication of those who paved the way for modern medical imaging. In 1931, a curious stretching device claimed to increase height by 2 to 6 inches. Post Office Inspector D.F. Angier and Dr. L.F. Kebler of the FDA tested this contraption, showcasing a mix of skepticism and early 20th century ingenuity. While ambitious, the machine highlighted a trend of inventive, if questionable, health claims during the era. This 1929 photo showcases the modern Röntgen look-through machine in Frankfurt, Germany, a groundbreaking advancement in X-ray technology. Designed to protect physicians from harmful radiation, it revolutionized medical imaging by ensuring both patient and doctor safety. This innovation marked a significant leap forward in diagnosing and treating internal ailments with precision and care. In the 1930s, as the health benefits of light therapy gained popularity, devices like the sun ray lamp became common. This photograph captures a man seated under powerful ultraviolet lamps designed to mimic sunlight. The treatment was believed to cure various ailments, including rickets and skin conditions, by boosting vitamin D production. Though cutting edge at the time, these devices now reflect the fascinating evolution of medical technology. This poignant image captures a young Gerald Blackburn receiving life-saving oxygen therapy in an oxygen tent at Princess Beatrice Hospital around 1937. Such innovative treatments were a beacon of hope for patients battling respiratory illnesses during this era. Gerald's story, and countless others like his, reminds us of the remarkable strides made in medical science and the enduring spirit of those who faced adversity. In this 1932 image, Lieutenant Ratke undergoes a fascinating experiment, manually pressing air into his lungs using a mercury column while a doctor monitors his blood pressure. This procedure, likely part of early aviation or respiratory studies, highlights the innovative and sometimes extreme methods used to understand human physiology under unique conditions. In 1928, the United States introduced a revolutionary device called the hip massage machine, designed to relieve muscle tension and improve circulation. This innovative contraption targeted the hips and thighs, promising relaxation and health benefits. While the machine's bulky design may seem amusing by modern standards, it reflects early 20th century fascination with mechanical health aids. This 1912 image shows a doctor in Manchuria donning protective clothing during a deadly plague outbreak. The gear highlights early efforts in infection control, reflecting the medical community's fight against one of history's most feared diseases. This 1902 photo captures partially dissected cadavers in the Jefferson Medical College's dissection room, Philadelphia. A cornerstone of medical education, such hands-on anatomy studies provided future physicians with essential knowledge, reflecting the rigorous training and scientific advancements of the early 20th century in understanding the human body. This 1915 image captures women operating a cutting-edge stretching machine for surgical dressings at the Red Cross headquarters in Cincinnati, Ohio. Amid World War I, such efforts were crucial in meeting the soaring demand for medical supplies, showcasing the vital role women played on the home front in supporting soldiers and advancing healthcare. This vintage photo shows a unique medical practice from the 1930s. The young woman is undergoing a treatment involving multiple water baths with electric currents. This method was believed to improve blood circulation, though modern medicine has since evolved. It's a fascinating glimpse into the history of alternative therapies and the lengths people have gone to for better health. This is a photograph of the R. Dubois anesthetizing machine, used in France around 1913. The device represents a significant innovation in early 20th century medical practices, aimed at delivering anesthetic gases to patients undergoing surgery. Operated manually by a physician, it reflects a time when precision engineering and hands-on expertise were critical for administering safe anesthesia. Such machines laid the foundation for modern automated anesthesia systems. Step back to 1938, a time when medical technology was rapidly evolving. In this historical image, we see dedicated nurses training to operate a respiratory jacket. This innovative device, a precursor to the iron lung, was crucial in aiding patients with respiratory paralysis. By understanding the intricacies of this early medical technology, we gain a deeper appreciation for the tireless efforts of healthcare professionals throughout history. Step back to 1929, a time when the fight against respiratory ailments was just beginning to gain momentum. This image showcases a woman utilizing an electric inhaling apparatus, a pioneering device that produced a medicated fog to combat colds and influenza. This early form of inhalation therapy offered a glimmer of hope during a time when medical treatments were limited. In the 1930s, patients at a German hospital used an innovative method for treating respiratory diseases. They inhaled powdered medicines like menthol and eucalyptus through specialized devices, as shown in this fascinating historical image. This therapy aimed to alleviate breathing issues and improve lung function, reflecting early advancements in pulmonary care. This 1919 photo depicts a woman wearing a flu mask during the deadly influenza pandemic that followed World War I. With millions affected worldwide, masks became a crucial defense against the virus, symbolizing a global effort to combat one of history's most devastating public health crises. This 1938 photo shows a patient inside an iron lung, a life-saving device used to treat polio patients with paralyzed respiratory muscles. The machine created negative pressure to enable breathing, symbolizing both the challenges of early medicine and the remarkable ingenuity of 20th century medical advancements. This historical image offers a glimpse into the early days of emergency medical services. The Wiener ambulance, a horse-drawn carriage, was used to transport patients in Vienna during the late 19th and early 20th centuries. The unique design, with patients arranged in layers, reflects the challenges of providing medical care in a pre-motorized era. The image also highlights the dedication of the Viennese Voluntary Rescue Society in providing essential medical services to the community. This 1900s photo captures a medical office aboard a hospital train, a mobile unit providing care during wartime. The organized workspace, complete with a typewriter and medical staff, highlights the ingenuity of early 20th century healthcare, bringing critical treatment closer to the battlefield.